Hello, this is Dr. X, a doctor working here today. May I confirm your name and age, please?
Hi, doctor. My name is Jennifer Lawrence, and I am 38.
How may I address you?
Please call me Jennifer.
Okay, today we are going to discuss your health issues. Will that be okay?
Okay, doctor.
Okay, during our conversation, I might take down some notes which will be strictly confidential. Is that all right with you?
No problem, doctor.
Okay, Jennifer, so can you please tell me in your own terms what have brought you here today?
Uh, Doctor, actually, I noticed that I have become fatigue for the time being, especially for the last 1 year. I cannot concentrate on my work. I cannot sleep well. And sometimes I wake up in the morning. And also, I noticed that my mood is also changing. And I told you that I cannot concentrate on my work. I even sometimes feel I am very low mood, depressed, and sometimes I even cry. Why this is happening with me? I cannot tolerate this anymore.
Yeah, I can get it. I'm very sorry to hear. Uh, I'm going to try to find out what is causing these problems. Can you please tell me that you told that these symptoms occurred 1 year back? Well, did all these things came along suddenly, or did these develop one after another, or gradually?
No, doctor, it came gradually. First, I feel no fatigue and low mood. And so the symptoms are increasing day by day, and this has now become so severe that I even cannot do my job properly.
Yeah. So I'm very sorry to hear. And can you please tell me that uh, does it persist the whole day nowadays, or is there any variation during the day?
No, doctor, I think almost every day I feel somewhat good at the as the day progress. Very, I feel bad, especially in the morning.
Okay, okay, and okay, and may I know that how frequent these are? These occurs every day now.
Yes, doctor.
Okay, and well, can you tell me that is there anything that makes you feel worse except that being in the morning? Is there anything special you want to mention?
Yes, doctor. I have some achy pains in my joints of my hands. That is also a matter of concern.
Okay, achy pain. Okay, can you please tell me that which joints are involved?
Yes, doctor. My joints of my fingers,
Okay, the joints of the fingers, both hands or one hand only?
both hand, doctor.
Okay, is there any redness in the hands?
No, just pain.
Okay, any swelling?
No.
Okay, is there any morning jamming present in your fingers?
Yes, doctor. Especially that is bad in the morning, and I even cannot move my fingers properly. That somewhat goes better as the day progress. Usually, I feel good after or during afternoon.
Okay, and you told this, and can you please tell me that is there anything that makes it better? This pain?
No, I didn't notice anything, but I had pain also before on my joints of my ankle, and at that time, my doctor gave me some ibuprofen and paracetamol. I took them. That helps me a little.
Okay, and you told that there was some pain in the ankle. Can you please tell me that was that pain similar to this type of pain, or was that different? That ankle pain, was there any joint morning jamming present also in the ankle?
No jamming, but the pain is somewhat similar to this.
Okay, and okay, that's all right. Uh, and can you please tell me that is there any is there any rashes anywhere in the body?
Not now, but I had rash, and I had some rash on my face. that resolved a few weeks ago, especially one mark around my cheeks. And also, I had some rash that also present about 1 year back. That was present
Okay,
on my back of my hands.
okay. And on the back of your hand. Well, can you please tell me that whether how did that go away? Is it go away spontaneously, or did you take any medication for that?
No, they went away spontaneously after a few weeks.
Okay, was there
Painful also.
okay, and was there any okay, and was there any itchiness in the rashes?
No, just pain.
Okay, just pain. Any deterioration in exposure to sunlight?
Yes, doctor. At the time, they went worse after exposure to sunlight.
Even those. Okay, and yes. Well, may I know that do you have any oral sore?
Yes, doctor. I for the last few days I noticed that I have some soreness in my mouth.
Okay, and is this the first episode, or did you have such episodes previously
No,
as well?
this is the first time.
Okay, and is it painful or not?
Painful.
Okay, and anything makes it worse or better?
No, I haven't noticed anything.
Okay, okay, and okay, and do you feel that there is any loss of hair in your body or in your head?
I cannot tell you exactly. I haven't
Okay,
noticed.
and what about the rash in the back? Well, you told that there is some rash. Is it itchy or painful?
Painful, but that is not present.
Okay,
That happened about a few weeks ago.
okay, okay, that's all right. And that went so okay. And can you tell me that? Mm, okay, and let me ask you some other questions now. Do you feel that you have got failure?
No,
Okay. Do you have any racing and pacing in your heart?
no,
Any shortness of breath?
no,
Okay. Uh, any leg swelling?
no,
Any chest pain?
no,
Okay. Do you have to use some extra pillows during sleep?
no,
Any chest tightness?
no,
Okay. Do you have any headache?
no,
Okay. Any changes in weather preference?
no, no.
Okay. Any changes in weight recently?
Yes, doctor. I have lost a few kg weights, and for the last 1.5 months, I have lost 3 kg about.
3 kg. Okay. Okay. Was it intentional or unintentional?
No, doctor. It is quite unintentional.
Okay. And okay. And yes, we will get to it later on. May I ask you some questions? Do you have any headache?
No,
Okay. Any problem in vision?
no,
Okay. Any problem? Okay. And any weakness in any parts of your body?
no,
Okay. And any pain in the muscles? You told some joint pain, but any pain in the muscles?
no, no. I haven't noticed anything.
Okay, that's all right. And may I know that what about your water work? Is that all right?
Yes, doctor.
Okay. And what about your bowel movements?
I didn't see any problem.
Okay. Do you have any lumps and bumps anywhere in the body?
During the crash, I had some lumps. Not now.
Okay. Can you please tell me that where did this appear?
Present on my hands.
On your hands. Okay. Well, which part? Can you please tell me of the hand?
Around elbow, doctor.
Around elbow. Okay.
Yes.
Uh, uh, okay. Was it a single lump, or were there many lumps? Actually, can you
Many
please tell
lumps,
me?
and it was painful.
It was painful. Well, can you please tell me that is there any food preference such which makes these
No,
symptoms worse? Have you
no, no,
noticed? Okay, okay, that's all right. And okay, and can you please tell me that uh, well, may I ask you that what about your are you sexually active? It's a personal question, but may I ask that?
Yes, doctor, I am living with my husband and I am married for 2 years.
Okay, may I know that are you on any contraceptive? Are you following any contraceptive methods now?
No, doctor, we are trying to get a baby.
Okay. Well, have you ever conceived?
Yes, doctor, it is a very bad memory that I had conceived about 1 year ago. And after 10 weeks, when I went to follow up, I noticed the doctor said that it is not alive.
Okay, okay. And well, is there any okay? And well, how is your period nowadays? I'm very sorry to hear about your pregnancy loss, but may I know how is your period?
It seems normal.
Okay. Now, may I ask you that is there any such symptoms running in your family, such type of weakness or any cancer? Do you know of
No,
any? Okay. Any heart diseases that runs in your family? Do
no,
you know of any or any history of sudden death? Okay.
no.
Do you yourself know about any previous disease history, long-term disease history?
Uh, I had a clot in my leg. For that, I needed to take warfarin for 6 months.
Okay. Warfarin procedure. When did you first diagnose? When was it first diagnosed?
It was about 1.5 years ago.
Okay. And okay. And well, and the pregnancy loss was around 1 year back.
1 year
Is
ago.
that right?
Yes, doctor.
Yeah. 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 Okay. And well, that plot. Okay. And may I ask you some personal questions? That do you smoke?
No,
Do you take alcohol?
very occasionally.
Okay. Do you have? I'm sorry to ask that some personal questions
It
also.
was very
Do you have any recreational medication?
no,
Any
no,
recreational
no, no,
medication?
never.
Okay. Any? Okay. And any drugs that you are taking recently other than warfarin?
No, I am just taking painkillers for my hand pain.
Okay. 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 That's all right. And well, may I know that? Hello.
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 Yes, I can hear you.
Okay. May I know what do you do for your living?
I am working as office assistant.
Okay. Okay. And is that are your symptoms affecting your work?
Yes, doctor. I need to transfer file from one table to another, but I find it difficult now due to my
Okay.
pain.
Yeah. Yeah. Yeah, yeah, I can get it. Well, okay, we will involve the social services as soon as possible to help you. Well, may I know what your concerns are?
Why I am having this?
Yes. Well, at this moment, I have to first examine you properly and assess you. But as far as I've taken the history, I think that the weakness that you are getting is maybe due to a symptom, disease named antiphospholipid syndrome or APS. What we tell, don't bother about the term. It's actually a problem in your clotting system. Regarding your uh, pregnancy loss and also some rashes that we have found out that these actually direct to that disease. But till now, we are not totally sure about it. We have to first do some blood tests and also they might involve the joint doctor and kidney doctor to know about kidney doctor and also the consultant to find out properly. Okay. And once we find out properly, we will get back to you as soon as
Time up.
possible and um, to help you. Okay. Is that okay?
Okay, doctor.
Any more concerns?
Are you going to give any medication for uh, my symptoms because I am suffering from lot from this pain?
Yeah, well, at the big, actually, it's important to find out the cause, and we will actually discuss with the consultant So whether we can help you right at the moment by giving you some medication or not. Will be okay?
Okay, doctor.
Any more concerns?
Is it a curable condition?
Okay. Usually, usually it may not be curable. Okay, if it's APS, but we can make the symptoms and the problems under control by giving the regular medications and making regular follow-ups. Is it okay?
Okay.
Okay. Any more concerns?
Will I be able to get pregnant?
Yeah, we will also involve uh, the female doctor, gynecologist, so that she can take a detailed, make a detailed assessment of you. But usually, it's not a total disappointment. Okay, many people can get pregnant despite having this problem. So we will involve her, and I think she can help you more about, he or she can help you more about it.
Okay, doctor. Thank you.
Is it okay? Okay. Okay. Any more concerns?
No, doctor. Thank you.
Okay. Thank you.
So, what are the differentials you have?
Uh, well, I think the differentials will be. I think it's my first differential will be fatigue due to antiphospholipid syndrome (APS), and uh, it can also be due to SLE, I think. Okay, and there can be some other causes, but I'm not sure about it. But it can be a celiac disease because of the painful lumps, small or multiple lumps that he trails in the elbow. But actually, here bowel problems, bowel are quite okay. So I wouldn't go for it at this moment.
Okay, between antiphospholipid syndrome and systemic lupus erythematosus, which one fits more with this scenario?
Sorry. Can you please repeat?
Between antiphospholipid syndrome and systemic lupus erythematosus, which one
Yeah,
fits better with this condition?
I think antiphospholipid syndrome.
Can you explain rash with antiphospholipid syndrome?
Okay. Well, I cannot. I think
Oral ulcer, can you explain?
no.
Joint pain.
No, I don't think this will be brought up here.
Okay, how will you investigate her?
Well, first of all, I will do the routine blood tests, like routine blood tests CBC, yeah, and also markers of inflammation like CRP, ESR CRP, and then I would also go for autoimmune profiling like ANA profiling, anti-DS DNA, anti-histone antibodies, and I have to go for urine routine microscopic examination to find out about the renal involvement or not, and also do some scanning of the chest, HRCT scan, pulmonary function test to see about the involvement, and I will also involve the nerve doctor, kidney doctor, and joint doctor to help us with further managements and investigations.
Suppose it is a case of SLE. How will you manage her?
Okay. Well, if it's a case of SLE, I will for I will have to first educate the patient and then counseling of the patient and involve the multidisciplinary team. And also, I will have to go for treatment of complications and go for uh, the treatment of the disease itself. Okay. And for her rashes, I think we might think of some topical steroids and for oral ulcers also, I think we can go for a topical steroids or a methotrexate, and or we will have to go for search for any kidney involvement. If kidney involvement was present, we might have to go for combination therapy with the steroid and mycophenolate mofetil, and for the pregnancy loss, we also have to make her coagulation profile properly, and if it's applicable, then we might have to go for blood thinning agents like warfarin or low molecular weight heparin in accordance with the hematologist's help.
Okay, thank you. And for this lady during history taking, I think you were a little bit confused because you should have
Yeah.
asked about what she mean by fatigue. Is he fatigue all the time or just start of the work or after doing some work? Okay,
Hmm.
so you could get a better idea that was it fatigue, weakness.
Can you please hold for 1 minute? Just 1 second, okay? Just one. Yeah, I'm sorry. Can you please tell again? Yeah.
Okay, then after the fatigue, when fatigue came, that was then fatigue or weakness, any side, any particular side or all over the body.
Mm.
After that, for fatigue, there are lots of cases, any rheumatological condition, any hematological condition, anemia, malignancy, the chronic disease, any chronic infection. You have screened for that. That was
Uh,
fine. That was fine.
Sorry, my current was actually interrupted. Can you please tell me how fatigue came all over the body? Current was interrupted, so I had to
Okay,
open
fatigue.
my.
Fatigue, was it all over? Was it
Yeah,
generalized
yeah, yeah,
fatigue or fatigueness or
yeah, yeah,
any
yeah,
some
yeah,
part?
yeah, yeah,
What
yeah.
did she actually mean by fatigue? Was it fatigue, weakness, tiredness, or lack of
Mm-hmm.
motivation?
Mm-hmm.
And also
Okay. Yeah.
she has depression. So
Yeah.
I could have asked, have you ever thought of taking your life? I am sorry to ask because that is a serious issue that needs urgent
Mm-hmm.
referral.
Mm-hmm. Mm-hmm.
Was this a serious severe depression or not? For severe
Yeah,
depression,
yeah,
I
yeah.
should have asked. Okay,
Mm-hmm.
and after that,
Mm-hmm.
it's checking out the time is short. So in the drug history, you haven't went it well. You should have asked about the medication list and any drug in the past that I would like to share,
Mm-hmm.
and then those any side effect because she is taking already ibuprofen,
Yeah.
and also this
Yeah.
patient had normocytic anemia. So there is
Yeah.
possibility of losing blood. So
Yeah.
you should
Yeah.
have asked that. Okay, and
How should be the question? Because I
and
asked about the bowel movement, water movement.
any changes in the uh, any changes in the color of stool, any black stool.
Okay. Okay. But I told about any problem in the bowel movement, so she denied.
Not with movement, then make problem
Okay.
with color. Okay, then
Okay.
past history and the allergic, you haven't asked it. Any past medical history, drug history, family history went well. Personal history, that was fine. Also, for this lady, when talking to the doctor or talking with the examiner, you should always use jargon or medical terms. You have when you are talking to the patient, you always use simple terms.
Yeah. Yeah.
And for this lady, most probable diagnosis was systemic lupus erythematosus. It can explain everything. Along with she
Yeah.
may have other rheumatological disease. Even it can be
Mm.
rheumatoid arthritis.
Yeah. Yeah.
And also she has depression, and along with she may have antiphospholipid syndrome, primary or secondary. In this case, most
Mm.
likely secondary to SLE.
Okay. 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 Mhm. Hmm. Okay.
Okay, overall,
So should I should have told that?
your
Hmm.
performance was good.
Okay. 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 So APS, in APS, I think rash. These are unlikely in primary APS. Am I right? Rash or